Shalom, and welcome to another installment, excuse me, of Elders of GMS giving all praises to Yahweh by Hashem Yahweh Shai. Today's topic is going to be entitled Current Events and End Time Prophecies. And basically it's going to be based upon the magazine, the Philadelphia Trumpet. There's a lot of articles in there, plus we got some articles that we pulled up, and we're just going to go into them. The first one, there's another one on DARPA. Go to that one first. And that's more news on the coming Mark of the Beast microchip. All right? So you can go ahead and read that.
This is from Yahoo News, entitled DARPA Developing Brain Zapping Implants for Injured Soldiers. Now, this is dated Wednesday, May 28th, 2014. The Defense Advanced Research Projects Agency, DARPA, is launching a program to develop technologies to treat psychiatric disorders by electrically stimulating the brain. DARPA's Subnets program, short for Systems-Based Neurotechnology for Emergency Therapies, will fund teams of researchers to develop brain interfaces, computational models of brain activity, and clinical therapies for illnesses, including depression, chronic pain, anxiety, and post-traumatic stress disorder. The project is part of the Obama administration or administration's Brain Initiative, a collaborative effort between government agencies and industry to revolutionize understanding of the human brain. The neurotechnologies we will work to develop under Subnets could give new tools to the medical community to treat patients who don't respond to other therapies, and new knowledge to the neuroscience community to expand the understanding of brain function. Justin Sanchez, the DARPA program manager for Subnets, said in a statement, "In health and disease, brain activity is not confined to distinct parts of the brain, but rather is distributed over different neural systems. The brain is also very plastic. It can adapt its anatomy and physiology over time. The Subnets program will take advantage of these brain characteristics to develop treatments inspired by deep brain stimulation for neural illness that aim to restore normal brain function," program officials said.
So in other words, that's another way of getting that chip out, because people are going to accept it, because if they have some form of brain damage, that can help them,
Yeah, one of the routes that Esau is going to use, one of the main routes, is that medical industry to push that chip. All right, that's one of the main routes.
And it's ironic because the medical industry, it makes sense that they're going to do it through the medical industry, through Obamacare, because in order to get that chip in your hand, your right hand on your forehead, you have to go before a doctor. You have to go to a hospital facility,
That's right.
Because ain't nobody going to have something surgically put in them unless they have some type of doctor or a specialist, perform that task. So it makes sense that it's gonna come through the medical industry.
Yeah, you have.
If I may say this.
Yep.
And then the government, they have instruction. Well, they told the different companies like VeriChip and all the ones that make these products that they have to set up instructions for these physicians and these doctors to follow in order to insert these devices.
Yeah, also you have that acronym, CHIP, which is really a children's health insurance program. And then that's the medical industry right there. So that's one way they're going to push that chip on your children through that company called CHIP, which is Children's Health Insurance Program. Reading on, it says, real-time closed-loop neural interfaces allow us to move beyond the traditional static view of the brain into a realm of precision therapy, Sanchez said. The program will fund 2 research teams, one at the University of California, San Francisco, and the other at Massachusetts General Hospital in Boston. The UCSF team aims to develop an implanted device that targets brain regions involved in an individual psychiatric or neurological disease. The device would record signals from and stimulate neurons in these regions in order to rehabilitate the malfunctioning brain circuitry. If the approach is successful, the device could ultimately be removed after treatment, DARPA officials said. The team at MGH will work to identify common components of neurological or psychiatric illnesses such as increased anxiety, impaired memory, or inappropriate reactions to things in the environment. The team will use behavioral testing as well as detailed recordings of individual neurons to discover these common features. The researchers will then work with Draper Laboratories, headquartered in Cambridge, Massachusetts, to develop a high-tech implantable brain device that is safe and effective that is safe and effective throughout a person's life. Yeah.
Can I say this real quick? Because they pretty much they've been pushing that in these new movies with Iron Man. That's what DARPA, I believe the actual DARPA building's in Iron Man. And RoboCop, basically he has the chip in his head. What was that other movie with Matt Damon, that recent one that came out last year? Elysium, Tawada. He had the chip in his head. So that's all those movies they showing you with the super soldier program, with all those what they call exoskeleton suits, with the super soldiers and everything. They all operated by that chip, which you could control it. They're trying to say you could control it with your mind once they put that chip in you. So what they're doing is they're further pushing that chip and showing you that it's a good thing. And that's why they started doing it at the what do you call that, when the soldiers come back damaged at those hospitals where the certain soldiers might have half of their body blown up. So they put them with these exoskeleton suits that's controlled by that chip. And then they start rehabbing, and then now they make it a good thing, and they pass it, they make it law eventually.
I got it.
Which proves that there are certain people that already have the chip. Like, we keep talking about the chip is coming. Chip is already here, man. Realistically, there are certain people that already have the chip. Some of these celebrities.
There's got to be a couple of million people that have the chip, if not hundreds of thousands, but they're not. In other words, you have older people that go in the hospital and they get that chip. You started the program with dogs and cats. Now the first family was a Jacob family out of Florida, and then the whole family, decided to get the chip put in them. It was a husband and wife and the child, and then you have other people that they don't make a big deal, and they don't show you on the news every time somebody gets a chip. But there's a lot of people out there, not just in the U.S. but around the world, that's receiving that chip. And then, like I said before, a couple of times before, that you're going to have classes that's going to get that chip. You're going to have the military, like one branch of maybe the special forces. Yeah. If you want to be a special forces, you can pass all the tests, but you got to get that chip. In case you're lost out there in the woods, the only way we can find you, where the enemy don't know that you have something on the outside of you, we're going to put something external in you. Yeah. They show you that in movies.
That's right.
The Manchurian Candidate.
Yeah, that's right.
They showed you that. And then many other movies. You mentioned Elysium, and other movies where they go into the Total Recall. They had the chip.